Well, almost 1 month after the tragedy at Robb Elementary School in Uvalde, Texas, the community still mourning and struggling to heal. Texas Governor Greg Abbott promised, quote, an abundance of mental health services to the community following that school shooting. But people in the town are hitting roadblocks and trying to gain access. NBC News Digital reporter Nicole Acevedo joining us here now. So, Nicole, why are people having trouble getting access to these mental health services?
Well, Stephen, you also have to keep in mind that even in a normal day before this tragedy struck Uvalde didn't have enough workforce or resources to meet the current mental health need at the time. That need increased with this tragedy. And basically, you see communities and even the government scrambling and trying to come up with resources to serve this community and this new mental health need. And with that, we've seen that people are feeling this disproportionate burden. Even though they're hurt, they're dealing with a lot, that it's on them to seek out these services. And you're talking about services that are not necessarily tailored to such a specific community, that a quarter of them don't have insurance, for instance. They're mainly Mexican American. There's a cultural competency aspect there as well. So when you put all these together, it has either turned people from seeking mental health services right now or just creating distrust, really.
That's a great point, highlighting existing problems that were there before this tragedy. And a 2022 State of Mental Health in America report ranks Texas last in the country for overall access to mental health care. Before that shooting, the governor cut more than $200 million from state-sponsored mental health programs. He's since promised those free resources, but the messaging there is a bit mixed. So how is that affecting residents and how they're seeking this care?
Well, obviously, the skepticism is there. They want to be hopeful that this is going to work, but they don't necessarily have the evidence around them. So what we've seen is a lot of people, for instance, I spoke to a therapist that said, I've been actively seeking out people through people that I know, people in the community, and trying to level that burden, that disproportionate burden that they felt that it was on them. And if it's not them, then nobody would help them.
That's a great point. It's definitely not going to forget the people there who are still struggling right now. Nicole Acevedo, thank you so much for that reporting.
Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.